Hi everyone. Wow, that's a good number of people to start off with. I think we've got about 170 teams registered for today, and I know some people will be sitting with their teams around one computer. So it's great that so many of you can join us for our little lunch and learn today. Hopefully you're all here for the engagement webinar. So my name's Holly Robinson and I manage the National Paediatric Diabetes Audit. So I'll just take you through what to expect over this lunchtime session. So this webinar came about because earlier in the year, we published the clinic chat report, which summarised the clinic chats that the ANDAS team here at RCPCH did, specifically with children and young people with type 2 diabetes. This was done in concert with the type 2 diabetes working group of the National Network for Children and Young People's Diabetes, because there wasn't any literature on children and young people with type 2 diabetes experiences of care. And there seem to be a lot of stereotypes and assumptions floating around amongst clinical teams about what the perceptions around the condition and care were amongst this group of children and young people. So the ANDAS team did a fantastic job, visited children and young people with type 2 diabetes at their clinics around the country and summarised the findings into a report. And the working group, the type 2 diabetes working group, then asked us to put together a session to help teams think about how they responded to the findings of that report. So we've got Emma Sparrow, who I'll introduce in a little bit, who is the head of the ANDAS team here at RCPCH, is going to talk to you about that, and also just some general engagement tips, because in the meantime we have also published our national PREM report. So that was the patient and parent experience measures that were collected over 6 months until 2nd of January this year, that we published, I think it was last month now. So I'm going to briefly take you through the key findings. I assume you've read the report, but just a little refresher to remind you why we're having this session. I'm going to share a few slides and hand over to Emma. It's very much the Emma show today, and then we'll have 10 minutes at the end for questions if you've got any. And yeah, we'll be recording this session if you have to leave at any point, and we'll put it on our website. So I'm just going to load my slides now. Okay, so just a very quick recap of what we found in our most recent PREM. The first thing to note is that you did an absolutely fantastic job of encouraging your children and young people and parents and carers to complete a survey. We had nearly 11,000 responses, which is only 3,000 less than we did pre-COVID, and this survey went out during times when there was huge disruption to care, but despite that you managed to get a fantastic response from families. So the main areas of achievement, the big message coming through the whole report is around perceptions of the diabetes team. Over 3/4 of all respondents agree that they always had a positive relationship with their diabetes team. And the other highest scoring area was that nearly 3/4 always agreed that they had enough information to manage diabetes at school or college. The assistance and support experience from teams as well was a key area of achievement. And I should have proofread that slide. I have no idea what that was going to be. But areas for improvement was generally around information. Again, information on exercise, glucagon preparation, transition, and many children, young people and their parents and care as well. Parents and carers did not have access to diabetes advice from their paediatric diabetes team 24 hours a day. So the qualitative findings, we asked children and young people what did they find helpful about their appointments with the diabetes team. And there was a difference this time compared to the PREM that we ran in 2019, and that's a result of the different experiences of care that children and young people and their families had as a consequence of the pandemic. So there was no reference to the modality of appointment in 2019, but this time children and young people and their families really wanted to highlight the benefit of face-to-face appointments. There were, conversely, some comments from families who found that video and telephone appointments were really convenient and were a good solution during the restrictions, and they did want to increase their options for different types of contact with teams. But generally, people love seeing you and have lovely things to say generally about your care and the support and the help that you provide. We commissioned out a machine learning analysis of all of the comments, and it found that children, young people and their families highlighted the assistance, the modality of the appointment and support as their top three. And those word clouds are generated from those comments. So we also asked, what could the teams do better to make appointments better for children and young people and their families? And not very helpfully for QI, but I'm sure this is quite validating for you to see, nothing was the most common response. A lot of very happy campers in your clinic, which is lovely to see. And that is what we found in 2019 as well. So despite all of the challenges in delivering care during the pandemic, a lot of very satisfied customers. Where there were suggestions for improvements, there were suggestions or requests for more assistance, and there's more detail in the actual report. We've broken down these themes into the sub-themes with examples if you want to check that out and you haven't already. And the modality of the appointment could be better. So for some, they hadn't quite returned to face-to-face appointments at this stage, and they were hoping to. And I just wanted to finish off by showing you the distribution of PREM scores, because one of the key findings of the audit was that there was similar findings to 2019, and that is an area of achievement for teams nationally. It's amazing that standards were kept that high during all the disruptions to care. But this just shows that there is still work to do locally to make sure that the experience of families and young people is uniformly high across England and Wales. So on that note, I'm going to hand over to Emma, who has got some ideas of how children and young people and their families can be engaged in improvements to services.
Fantastic. Thank you, Holly. Hi, everyone. It's a real pleasure to be here and to share what children and young people have been telling us over the last couple of years as an RCPCH Andus team, but also to be able to share with you some of the results of the Type 2 report that we did at the end of last year and went into this year as well. So let me first up share what is going on my slides. One of the things just to say is I know that I could probably share the slides in a different way, but I have to work, unfortunately, with the Wi-Fi that I've got right now. So I'm sure that you will stick with me on that. So we always start, and this has come directly from our children and young people, with a little bit of a shout out to a rights-based approach. So this is the way that we work with children and young people within RCPCH to make sure that we're able to inform our principles and our approaches using the United Nations Convention of the Rights of the Child. So this came out in 1989, 1990, and is a series of different articles which nearly all parts of the world, apart from the US, have signed up to make sure that children and young people have the best start and the best hopes and aspirations for the future, and are able to stay safe and healthy and well and supported, but really to be an active part in what is going on. And UNICEF has taken this into kind of like a 7 set of things that you need to do to have a rights-based approach in your work with children and young people, which also is really helpful for us to give us some of those things to always think about. So to make sure that we are, you know, treating them with dignity, so that we see them as their own individual people, that we really listen to them attentively, and make sure that at no point we're maybe playing into power dynamics that might happen within the systems that we work in, to make sure they've got the chance to really actively inform and influence what we do. But as always, as you'll know, that we're checking out what their life, survival and development needs are. So are things coming up that actually aren't really for us to sort out, but we're hearing or giving them some areas of concern, and that could be low level in terms of well-being, all the way through to very significant harm that would go through our safeguarding processes, obviously. Are we making sure that we're working with them in a way that doesn't discriminate them? And that could be because of their age, it could be because of their information or communication preferences, or it could be because of maybe their condition has some challenges or the inequalities that they might be facing as an individual. We want to always make sure that we're working in a way that they can understand what we're doing and why we're engaging with them, or how they can support us, and that we're really clear on that, particularly I think within complex health systems that we operate in, and that as ever their best interests as children and young people are kept at the forefront. But we do need to make sure that we don't elevate different parts of expectations or need against others. So one of the things, for example, for us is to always consider, do we take them out of school to be able to do an activity with RCPCH and us? On the whole, we won't, unless it's something like annual conference, where we know that actually we're able to get them an authorised absence because we link it back to their curriculum. But one of the things that keeps coming up, particularly over the last couple of years, is their right to health and their right to education needs to be as equal as possible. Because if they have got health needs, then it can already be quite challenging for them to be out of school or to be seeing lots of different consultants or appointments or health teams, which can lead them to miss some of the other stuff that they are looking for in terms of maybe rest, relax and play, which is Article 31. And for us, all of this links into Article 12, which is the right for their voices and views to really have an impact on the decisions that affect them. What this means then in how we kind of like boil this down again, so coming from kind of the UNCRC through to a rights-based approach, is something that we've adapted from Simon Sinek, which is about the kind of like start with why model. And that is about thinking about your engagement foundation. So why is it the right thing to do to involve children and young people in this way, and to have their voices not only involved in their individual healthcare, but also the service needs or the service changes or quality improvement, for example? How will involving them make a difference? So how will we make sure that actually it has impact, and that we've thought through the questions that we're asking, or the way that we're seeking their involvement will make a difference to them as an individual, will make a difference to them as their community, but also a difference to the strategic or, you know, kind of like society level thinking that's going on. And then what do we need to do to be really successful in the way that we're doing engagement? So is that about our style or our approach, or about the way that we bring them together, or about the kind of questions that we're asking, and are we making sure it's the right questions at the right time to the right people in the right place? And normally what we find happens with engagement is that it goes the other way. People think about what they need to ask, they think about how they're going to ask it, and they think about why it's important for them to ask at this time. So always doing it the other way has really helped us as a team to kind of like question ourselves and make sure that we're staying true to what's going to make the biggest difference. And that why piece is really about the belief system. So we believe that children and young people fundamentally have a right to have their voices heard in shaping what's going on for them, and to be really central to that. So the why, how, what model is something that helps us to always operationalize some of the strategic things that we're having to think about. We also have to think about what engagement means, because it means so many different things to so many different places. Coming from a different sector into health, it was interesting to learn just how many different ways we could say children and young people's engagement. So it could be involvement, or patient and public involvement, or patient public involvement and engagement, or patient and public voice, participation, co-design, co-production, all of that. Ultimately, for children and young people, it's really important that we make sure that we've got the same understanding. Because when we've said to them, you know, what does youth engagement mean to you? They've told us that it could be that there's someone getting married, they're quite young, and maybe we need to do something about it because they don't think they should be maybe getting married or having those kind of relationships. So it is super important that we actually really understand, going back to why, how and what, if we're thinking about engagement, maybe on PREM results or maybe on the type 2 results, what we are going to do to make sure that that message is clear, that the whole team, and that's patients, children, young people, public, parent carers, staff from all different teams, schools, everywhere, understand actually where we're going and why this is so important to us. Because again, in research, engagement can mean that we're at the end stage where we're disseminating findings. So it is important just to make sure that we think of all of those those elements and really define it well. Now, we've had some children and young people involved in the past and over lots of different projects. Last year, they worked with the Academy of Medical Royal Colleges. So Dr. Helen Stokes-Lampard led a session with us, with them, to really look about actually through the pandemic, it feels like there's been some shifts. And what do we need to make sure that we're maintaining in terms of having good engagement or involvement, as they've gone with for this one. So I've got a quick little video which I hope will play. And if Holly or Natasha could just let me know if the sound is working in a second, that would be brilliant.
Before you ask us to give our opinion, make sure that we have all the information we need to make informed decisions in a format that works for us. New ways of thinking in healthcare. Technology has forced a new way of working. We need to develop a new strategy for health practice to follow, making sure that it's designed with children and young people because it's our healthcare. Voice. Know about our rights. We have the right to have a say about matters that affect us, what we want to happen, and that we are heard. Opportunities for more choice with appointments. Offer us a hybrid approach in how we have our appointments and how services are delivered. Think about what we want, what works best for us, and what we are most comfortable with, so you can provide a more inclusive service, catering for all. Level the playing field. Treat us as equals. We understand if you explain it in a way that works for us. We need more information for all children and young people, explained in a range of ways to make sure we can all be included. Visual and clearer information for children and young people. Co-produce information that informs children and young people about what is going on, what is useful to know and will help us. Engage with more young people. Work with schools and hospital youth forums. This will help inform more young people of the healthcare opportunities and services that are available to them in their local communities that can help us to understand what matters most. Ask us what the service should look like. We know what we need and what works best for us and other children and young people. We see what we are all going through, and we can help you move with the constantly changing landscape. And finally, demonstrate impact. Show us what difference we have made, where we have made a real impact to your service.
So as always, no one says it better than the young people. So like I said, a group of young people came together. They had all different health needs, from very complex needs, seeing multiple different teams, through to engaging maybe with mental health services or supporting others. So sibling carers were part of the project, and also children and young people that maybe were, just in receipt of health promotions or healthy lifestyle information, just to make sure that actually we were able to really think about how the pandemic maybe we needed to reframe what we were doing to make sure that they were able to engage well. Now, our approach at the college, some of you might know this, so apologies if you've heard it before. As Holly said, we've got RCPCH and us, which is our Children, Young People and Families Network. And the words that they've chosen to explain what we do on the screen. So we educate people about what matters to them. We collaborate with children, young people and decision makers to make sure that we can come up with ideas and solutions for the future. We engage children, young people at all different levels to lead out their own solutions. And it's all about making sure that there's some change. And the way that we do this, which is the same whether it's like a 5-minute chat somewhere all the way through to a long-term project, is that we always maintain that a third of it has to be fun, because we don't pay them anything. We, they're here as volunteers. They're here to, make a difference. So we need to make sure that actually, it's something interesting and fun and different to do, and not where they feel like they're being rinsed for data, or where they feel like it's a very controlled and strict and quiet environment, which is what they might be experiencing sometimes in education. We make sure that a third of it is their agenda through whatever the conversation is, or the project, or the roadshow, or the challenge, for example. Because again, that goes back to a rights-based approach where we give them space to tell us what's important to them and to work on it, They know through our facilitation what the parameters and boundaries are. So if we're on an epilepsy project, for example, then it will be about epilepsy. If it's on a diabetes project, it'll be about diabetes. But actually, maybe some of the audit data isn't the thing that they are most driven by. Maybe it's something else they've seen that we're not tracking through the audit. So we support them in their part of the agenda to work on that. But a third of it, we're very clear, is about the reason why we've come together, which for us in a programme like this is often about audit data. So we will bring them audit results, we'll get them to feed into, you know, some of the strategic planning, we'll get them to review materials, to youth proof it, to create responses and solutions that really hone in on what has come up through the audit results. And through all of this, it's really asset based. So we try wherever possible not to talk about, you know, what's the worst thing that's happened, what's not working, but to think about, you know, how could we, you know, make sure that everyone's got the same best care everywhere they go. And we do that through roadshows and consultations. So we ask children and people what's going on for them and what matters. We do taster days or challenge days where they come together and review the results from others and create recommendations. And sometimes that turns into long-term projects that go on for maybe 2 days is a long time for a child or young person. So a weekend project, or it could go on for kind of like 5, 6, 7, 8 years as some of our projects at the moment that we're running. And through all of that, we make sure that we work with a whole range of different children and young people. So it's not just patients that we work with. We make sure that actually through all of our long-term condition-based work, there are children and young people who have come to us through more open access places. So that could be schools or youth centres or play centres, or by meeting them out when we're doing some community outreach. We make sure that they are involved because they might be using the service in the future. They might be supporting a friend or family member. They might be sitting next to someone in school that is checking their levels. So it's important in terms of raising awareness that they have opportunity to learn about different conditions. But actually, the other side is it's important for children and people with long-term conditions to not just be those people, and to be able to have fun and talk about other stuff and be with other children and young people in a kind of like an equal footing. We also make sure that we speak to children and people who have got health inequalities or those kind of experiences. So we will actively go out to a young carers group, for example, and speak to them. We'll go to an LGBT group or to a faith-based group, just to think about how maybe certain conditions or health experiences or health services might need to change to make sure they're as accessible and inclusive as possible. And then we always work with specialist voices. So they're children and young people with the experience of the condition who are accessing paediatric services. And normally we meet them through clinic chats. Like Holly said, for type 2, we did clinic chats across the country. We've got type 1 clinic chats happening at the moment. So we have got 5 different places that we're heading to over the next couple of weeks. And thanks to everyone that offered their clinic. There's more opportunities coming up next year, so don't worry. We'll try and get around everybody. Or we'll go to condition-specific forums that have already been set up. So, for example, there's a diabetes youth workers network now. Some of them have got youth forums specific for diabetes care, or for residentials where they're taking diabetes patients away. There's some brilliant work going on. So we'll also access people through there. But really, it's just about always making sure that children and people have the chance to use their voice and to help improve child health across not only their own patch, but actually to inform what's going on elsewhere. Now, one of our other projects that happened through the pandemic was the book club, and they came together at different points to look at maybe what were the experiences of life in lockdown, what was needed in terms of a vaccination programme or vaccination centres for children and people. And they reflected on that, and I think that it would be really relevant to where you probably are at in receipt of lots of audit data, but also working with lots of children and people and families in your area and thinking about engagement. So let's hope that this one works as well.
So overall, when I think about our experience as a group, the most important thing for me that came out of it was that we were all given a space to kind of learn as we went along, and we were given a lot of space for creativity. Working on such a big project completely virtually meant that we didn't exactly know how everything would work from the beginning, but we learnt a lot by staying open-minded throughout.
A top tip would be to keep an open mind throughout the project and adopt ways of working which work best for the group. There's no set rules on how to have an effective meeting, and there's lots of different ways to make sure members feel supported when it comes to mental health and well-being. So it's just important to do what works for everyone involved.
When seeking to engage young people, never patronise and always explain the value of the work we'll be doing. This also means engaging us from the offset by allowing us to identify the problem, target an audience, and show them that our solution is implementable. Inspire us by continually asking why and getting us to think deeper and more specifically about the problems we're challenged with.
So again, good tips there from book club. So thinking about actually how, as the last slide says, you know, how can we just rip it up and start again if it's not working? Because sometimes that's what we need to do. And we do, as a network for RCPCH and us, work with all children and young people. So we have experiences of working with non-verbal children and young people, children as young as kind of like 3 and 4 telling us what they need from service improvements, for all the way through to young adults who are kind of like at the top end of 25. Often with lots of different experiences that all comes out, often in mixed groups as well, just to make sure that they can learn from each other. But sometimes we need to know that actually we're not the best person to work with certain groups. So we'll brief other staff, or we'll send in activities, or we'll work through parents and carers where maybe it might be more appropriate for them to do some one-to-one work. And then we'll have different groups of children and young people then that are willing to represent that on videos and to do voiceovers and to pull learning together. So that it really fits actually where children and young people are at in terms of their experience, their interest, and, you know, whether they want to stay for a 5-minute chat in a clinic or whether they want to join like a long-term project and review lots of data maybe about COVID and come up with learnings for the sector. The other bit I think to just consider in terms of when you're thinking about what sets up those engagement foundations are some of the stat guidance that's out there. So in 2021, there was new NICE guidelines around experience of care for babies, children, and young people. These have been created by a lot of children and young people with different health needs coming together and sharing what they need out of health services. And again, you know, there's nothing here that you wouldn't expect to see, but because now it's a NICE guideline, it's really important that units are taking time to look at it and to think about actually maybe using the checklist that has been created, you know, where there are elements that we want to check out with some of our children, young people and families who have got different conditions maybe within the diabetes networks that you work in. Also this year, as part of the Health and Care Act, there was new stat guidance that came out about how the NHS will be working in partnership with people and the community. And again, this goes through different stages around, you know, how we tell them about what's going on or let them know about their results, for example, how we make sure that they're able to tell us what works for them and what their ideas and suggestions are, all the way through to how we start doing that process together to make sure that actually we're co-leading change going forward. So there's lots out there already to kind of give us some thoughts and give us some ideas. But sometimes it's hard to kind of like go through all that and just work out, well, what does that actually mean for me or for our team. Now, for just going back to our kind of like different model of the people that we work with, so whether they are all children and young people, so that's that kind of like universal group, to those experiencing health inequalities or those who have got specialist voices. So for all children and young people, this could be that actually think about your community footprint. Have you got schools nearby? Have you got youth centres? Have you got a St John's Ambulance Club or a guide group or something that is open to all children and young people to go to? And could you maybe pop in and do a session with them or a class or, you know, work with them at some point during the term to just, you know, think about what matters to them in terms of healthcare. What do they think diabetes is? What do they think they could do to support maybe a classmate who might have diabetes, just so that we can start getting those kind of like open thoughts coming in about maybe the information we need to provide or how we need to you know, make sure that actually it's a community effort to support people and that we raise awareness. Thinking about those facing health inequalities, it could be that you have got a young carers group locally, they're a statutory requirement. It could be that you've got a children in care council. It could be that actually there's a number of different places that you can access through your local offer. So if you're in England, there'll be a website that's got your local offer information on it. If you're in other parts of the country, then it's collated together in some of the voluntary sector web pages, for example, MEC, I think in Wales. And then, you know, maybe do a challenge or a competition. So get one of the ideas that's come up from your universal open access, get your health inequalities, you know, create just a one page that says we would love to know how we can improve understanding about this condition in different community groups, and you know, just run it like a dragon's den, see what comes in, see what you can work with, and you know, just get the word out there, because actually it's about building connections and building links in and out of communities. And then take that to your specialist voices, so the children and young people that have got diabetes, for example. And you can do that by having a question of the month in clinic that starts to build, you know, we've noticed that people don't really understand diabetes. We've had some ideas about actually it would be really good to have some videos that explain it for the wider community. Does this feel useful to you as a person who's using our service? And is there something that you would like to chip in and support on this? It could be that you can set up a Menti, which is an online voting thing, and have people voting between clinic appointments. It could be that you've got a forum, or you've got a hospital youth service or a hospital school, or, you know, there's lots of different ways that actually you can then start to bring all of those three groups together and to share their voices, and then create something like a crossover project where, you know, maybe you set up a takeover challenge, and, you know, on a Saturday you have an open space, maybe, you know, like outpatients if it's not being used, and you bring some people together to really look at actually how can we take each idea that's come forward and do something together, and always linking it back to Plan, Do, Study, Act, and think about, you know, those short-term interventions or steps that actually you can just track to see if they're making a difference, and then if they are scalable. Now, as you've heard, we did go out and do some clinic chats around type 2. It was a project that started before the pandemic. We were all geared up, ready to go, and we'd done some clinics, I think, in February 2020, had some set up for March 2020, and then had to obviously delay as the country got locked down. And then we really, you know, thought about if it's the right time to be going out and talking to children, young people and families, when actually they've got some other worries going on. So we picked it back up again once services were more open and more able to have us come in person, because it was quite important that we made sure that we were thinking about actually, you know, we don't want to add harm or do more damage by what we're talking about, particularly if not all services are fully open to them yet, and being able to have you know, maybe mental health support. Please just excuse the fact that I've got one of my dogs that just walked in. So some of the key things that came out of the type 2 diabetes clinic chats was around accessible support, about wraparound care, personalised information, emotional support, and also thinking even back at the start of the pandemic, but certainly you know, once we'd done the chats last year, but even more so into this year, about the cost of staying healthy. What we did find out is that actually there was lots around missing out on things if you're a type 2 patient. So maybe missing out on some of the information, missing out on support because of the low numbers, definitely missing out on the fact that people aren't aware of type 2 in children and young people in the wider network and wider communities, and people questioning, actually, you know, at school, are you sure you've got type 2? No, I don't think you have, you've got type 1. You don't know what you're talking about. Missing out also on some of the things that they see type 1 patients having. So, you know, we got told about the bears and the books and the bags that maybe they were given, but it wasn't really for them. It was a different name. It wasn't for the same condition. And just thinking actually that, are they going to start missing out on their futures? Because, you know, there were some scare stories that we were being told, but there was also quite a lot of knowledge that seemed to have been missed out in terms of what type 2 was, and what were some of the things that they might need to do to stay healthy, happy and well. And I guess that comes from that kind of like reiterating or reassuring it from all the different places for more commonly known conditions or understanding. People could at school maybe add to what they'd been told in clinic, whereas we were starting to hear that maybe some of the things that were being added to weren't for their age group, for example, which won't be some, you know, you'll know some of this, but it's interesting to hear that being reflected from children and young people and families as well. So just going back to that why, how, what, So, you know, why this was important to us was because, you know, like I said, we believe that children and young people have the right to the best health services and best experiences when it comes to their healthcare. So if there is not as much information out there as to what's going on for them as type 2 patients, then we needed to understand that, so that, you know, that was really our belief system. They need to have a voice and it needs to be heard. How it was going to make a difference was by informing some of the national thinking. So Diabetes UK, for example, have taken some of the feedbacks. I know that some of the other organisations that work with NPDA have taken some of the requests and have already started mobilising and operationalising around resources to create information for children, young people and families. But also, we really wanted children, young people and families taking part to feel empowered and to know that actually they were part of the future. So how it was going to make a difference was also to those children, young people, in telling us, you know, what they hope they could, that helps other people going forward. And then what we did to be successful, so we did some desk-based research to see what was out there on forums, on web pages, on charity websites, and to kind of work out what is the level of information that is available. We did clinic chats like you've heard, and basically a clinic chat is where we do sit in outpatients or we sit in a clinic room, we speak to children, young people and families, sometimes between heights and weights and their clinic appointment, sometimes after, sometimes while they're waiting to move around to psychology or dietitians or whoever else is in the MDT for the chunk of time that they're there in clinic. And as you can see on screen, you know, we've got different things that we would give them. So depending on their age, we might have a gingerbread cutout and we would ask them, you know, what keeps children and young people with type 2 healthy, happy and well, and we would plot it on according to, you know, kind of like where it fits on the body. Or we would write around the outside if that was someone else that could help them be healthy, happy and well, and how they might do that. So it could be, you know, like school understanding, letting me check levels in the room, you know, being clear as to what's going on. It could be though that we had a piece of paper with one side saying child or young person, one side saying parent and carer, and we would ask the questions and then note it down on each side, because that would mean then that we had a visual cue that we could use if maybe one of the groups wasn't talking, but also we could separate out what had been said. So we would be able to go, you know, come on then, you know, your young person's told us everything, you know, how does this make you feel, or you know, what would be useful for you as a parent or a carer finding out about type 2, for example, for the first time. We also made sure that we were giving them signposting information, because lots of things would come up that wasn't necessarily about the questions that we were asking. If we had the ability, we would walk them down the corridor and speak to one of the specialist nurses or one of the clinical team and say, look, you can ask that question now, if this is what you're thinking about. Or it could be actually that we could, you know, give them information about the audit, or about where to go if there was questions about benefits, for example, and how to get the support that you need with an education healthcare plan. And we always made sure that we were thinking about actually the use of our language and how we had to be really careful. So we worked with a mental health worker to make sure that we were using mental health informed approach in our participation and engagement methodology, to really think through how can we have these conversations without, like I said, creating more damage or harm, by making sure that we are not adding to some of the guilt that is felt around having a type 2 diagnosis for a child or young person, or some of the burden about managing the information that's going from child, young person to a parent carer. But also to just think about how maybe by talking about that wider community, we could move it from them, but use their experience into something that's more solution focused. Because don't forget, we didn't have long, we had kind of like 5 to 10 minutes to speak to people in the clinic. And then we had to be really, really clear about what our power dynamic was within the situation. So we always have like purple or blue t-shirts on that say RCPCH and us. We're very clear we're not part of the medical team. We're clear that we're not at any part of their care programme or care pathway. We've come from a charity to find out what you know we could share with others in a really clear, anonymous way that can help inform priorities going forward. And I do think that's one of the challenges that units face, actually, is that power dynamic, because what we've heard throughout the pandemic is that children and young people are incredibly grateful as to what you as teams have done. They believe that you've saved their life in many, many different ways. So whether that's with their diabetes care, whether that's with the pandemic, they hear as well on the news that, you know, systems are really struggling at times, and they don't want to add to that. So if we ask them a question, sometimes from the medical team, as to, you know, how can we change things, they'll say that you can't, because actually you're doing the best that you can do, and they don't want anybody to feel a certain way about, you know, maybe not doing enough, or they don't want to, though, you know, they might be worried about what that might do to their care if they kind of like say, actually, I prefer it to be different. So it is really important to think about who are the other places that you can go to maybe pull in support which isn't maybe from the hospital or from the team, to really talk to patients and families about actually what they're thinking and what their ideas are. And it definitely makes a difference that we can come in and say that, you know, we're not part of the service. So you might have youth workers, you might have I don't know, a university with students. So, you know, there might be lots of different ways that you can pull in other support on this, and just to see if actually that might also help with some of the resourcing of making this happen. So just thinking then about the results that we found, and some links then back to engagement and maybe what this could do for you. And again, this bit is just about type 2, but lots of it is transferable to type 1, and obviously the engagement side is the same really for both. So accessible support came up, where children, young people and families talk to us about the need to really understand they don't all access information in the same way. So there was lots of people that said they would love to go to a group. There was lots of people that said they would hate to go to a group, and that they wanted to have something one-to-one and to be able to talk to an expert and then work out actually what they wanted to do. However, like you can see on screen, some people said that it would be better if they could meet other people with type 2, and to, you know, feel like they had people that understood what they were doing and what they were going through. There was people that said that they wanted like workout videos, maybe that was very specifically about, if you've got type 2, if you are trying to make healthy lifestyle choices, then this is a wicked activity that you can do at home, doesn't cost you anything, and will really, you know, keep your levels, blood sugar levels, you know, the right way, and really talks to who they are at the time. They knew that they could access ones for anybody, but then they're worried that maybe they're going to do something wrong because they've got type 2. So they quite like it to mention type 2, so they know it's definitely for them, but it's also for their age group, because a lot of what they were finding was for older people, and they didn't know if actually that was for them as well. They also mentioned that they're not necessarily on websites, they're using TikTok and social media and Instagram and following influencers who have got conditions to see what they're doing. So to think about actually how we move some of our content somewhere else. I know that, for example, in our asthma audit project, we came across Croydon Hospital at Home, who have got quite a good Instagram account that they really use to follow up with patients that they've done a home visit with, to then say, it's okay, we'll post that on the Instagram and then you can see it later, just to remind you about the different things that we've spoken about. So, you know, just thinking about different ways that you can use materials. They definitely wanted there to be an opportunity to go out with someone. So outreach programs kept coming up, because actually they wanted someone to go shopping with them, and that'll come up in a bit, that, you know, it's really hard when you don't know what to buy and you're with your mates and you haven't got a lot of money and you've got a minute to choose, and everyone's choosing one thing and you don't know if that's what you're meant to choose or not. So just to think about that bit, but also to see how some of that learning can go into different services like school, like you know, sports clubs that they go to, or youth clubs, or fun stuff that they're doing. And that kind of goes back to that bit at the beginning about working with all children and young people as part of an engagement plan, to make sure that actually the more people that know, the less of a taboo it is, the less of a stigma there is, and the more peer support there can be that doesn't necessarily need to come from being at a patient forum, for example. So just thinking about how we can move some of that information around between GP, school, youth club, specialist, other services, for example, mental health services. So engagement wise, it could be actually, just going back to the slide earlier, that, you know, there's a workshop that happens in school that talks about, you know, how we can get information out to you in a different way. And then we think about how we pull it all back together with our children, young people and families with specialist voice experience, to double check that actually, you know, if we set up a bit of a shopping programme, who did you want to do that with? So maybe a youth worker could be trained that's from the local authority or from a charity, and then maybe the youth worker goes out shopping with them, knowing that they've got the right information that's come from the specialist medical team. Wraparound care really goes into thinking about this in a more holistic way. It kept coming up that they're not just type 2 experienced people when they're in clinic, and that they needed some more help around some of their choices and some of their experiences outside of clinic, and that if they only come you know, a few times a year, they'll forget to talk to you about some of the areas that they're really struggling in, which could be about maybe how, you know, they've got exams and, you know, they're finding that more stressful, so they might be doing some more comfort eating to, you know, get them through the 25 different exams that they have in a 2-week period. It could be that actually, you know, there's some family things going on which is making them feel stressed, and they're not really managing to remember all the things they're meant to do to live a healthy, happy and well life. Or it could be that actually some of their extended networks are not supportive, because they don't understand that actually type 2 is something that's affecting children and young people as well. So is there different materials that could be created to support their extended support networks? So one of the things, like I'd already said, is about, you know, having someone that can go shopping with you, having cooking classes, creating materials that actually are for the wider family network or the friend network or school or club, whatever. So again, could be that actually the information is understood in the specialist voices, and then it's given out to health inequalities groups or to all children and young people groups to work out actually how do we share this information with you. And, you know, could this then be created into a leaflet, or I don't know, they talked about, you know, something that you can take a screenshot of so that it's on your phone at all times, and then that could be passed out to others too. We've got a health diary that you can see pictures from on the screen that helps children, young people and families to collate things that they're doing, to note down where maybe their condition has had an impact in some way, to jot down their feelings, track their feelings as well, and their questions, which could be a useful tool to use between appointments. And that's where the personalised information really is important. So the quote on screen came up a number of times with a particular community group that we were getting information from, about maybe, for example, if you're in the South Asian community, to refuse to eat the food that you have been provided by your nan when you go round at night would be incredibly rude. And actually it might not be that you've shared your diagnosis with the extended family, but you might already have had food on the way back from school with your mates, because that is part of the youth identity that you're also trying to maintain. And that having this understanding of actually where you are as an individual and how that will change as you know, from when you're a child and you're being given things by your family. So I think the youngest we spoke to was 9 or 10, and you know, they were talking about going to community gatherings and you know, like big family events, and they just didn't know how to manage the fact that everyone was giving them particular sweets that they were supposed to eat at that kind of like family celebration. Through to, you know, what you might do if you're 11, 12, 13 and starting to go on school trips without parents or carers with you, through to, you know, how you manage the transition to going away to college or university, or starting a Saturday job for the first time, and, you know, being out and about but not really knowing what you're meant to do, to tell people that you only see infrequently that you've got type 2 and this is what you need to do to stay healthy, happy and well. So that real personalised approach to, you know, scrapping all the templates that we've almost got, and then just starting again on a blank sheet of paper and being like, actually, this is about you. And again, Young People on one of our other projects has created some resources about that too. And as we get to the end of the kind of like results, you know, mental health did come up a lot about how actually they need support to manage their own feelings. So whether that's about guilt or shame or blame, if it's coming from, you know, I've done this and my parents told me not to eat this stuff and now this is where I'm at, or parents feeling a certain way, or children and young people managing that burden for parents that they can see are struggling maybe without having enough money, or without having enough information, or not having English as a first language, or as young people understanding way more about type 2 but being told it's something different because parents have got experience of their own type 2 journey. So I think it's important that we, you know, through engagement, we work with different groups of children and people. Again, it can be universal, it can be health inequalities. It doesn't all need to be our specialist voices, children and young people that are kind of like solving all these things. Because again, that just adds to what they're already managing. By mixing them up and making sure that actually no one has to say who they are, then it becomes a collective, you know, kind of like social action, youth action project, or response, or, you know, like we do this in 2 hours sometimes with some of our groups, and they just come together on a one-off. But it's really about making sure that, you know, maybe like the emoji cards that have been created by children and young people, maybe there's something like that that could be created, so kind of like flashcards that can be used in different environments, or like the carers card that children and young people have created for schools, just to help them understand where they're at the time, and so that different services can understand how to support them. Now, just finally, the need to have a real mindset on actually where people are at. This came up before the cost of living crisis that we're in now, but we were told very clearly that, you know, there isn't the opportunity always to eat well, to move more, or to even get to appointments, and to get that support from different people, whether it's a project that you've been told would be wicked for you to go to, but actually there's no way that you can travel there because it will cost too much. So engagement wise, again, just thinking about, you know, are these some of the things that maybe we can have different groups working on with us to help us to understand how to do something differently, or to work with different partners and to bring together the people that are kind of like there in your trust, in your council, in your local area, who are all experiencing different parts of this. So either by being worried when someone puts on their consent form to join football that they've got type 2, so they kind of say we haven't got any spaces, or whether it's, you know, like a youth parliament or a youth cabinet that's doing some universal work on cost of living crisis, or within your trust having a quality improvement programme already going on about actually how we can make sure that the was not brought numbers go up, and that we have more children and people being seen in clinics so that they can be helped to lead the best healthy life. There's lots of ways that children and people can be part of this. And some of the ideas are at the start of this short presentation. Some of them are in resources that we've got, but it could be, you know, thinking about review the findings from the report as a team, you know, take it back out and talk to children and people in your local area in a one-off. They would love to hear from you, and to be able to, you know, have their say. To think about that language check. Is there any language that we're using that can be a bit blamey, or that maybe they don't feel is helping them? So we had some children and people saying, well, you know, there's no point because I've been told my foot will fall off, so like what's the bother? And, you know, to really think about how we can build this as a kind of like collaborative model. And, you know, there's loads of resources, like I said. So we've got a whole module that children and people have helped us to develop, with videos from them picking out the things that work best for them too. So that leaves probably like 7 minutes, I'm afraid, for questions. But hopefully, you know, it's been a little bit of a kind of like run through as to what engagement means to us. So why, how, what, how to kind of like bring together some of those results from the type 2 into understanding for you as units, and then a little bit of signposting about some of the resources that are out there, including RCPCH and us, of course, and lots of other organisations.
Thank you so much, Emma. I can't believe how much you managed to fit into 40 minutes. You must be exhausted. That was really good. And as I said, we filmed it. So if anyone wants to go over that and listen a bit more slowly and unpack some of that, you can do that. So yes, we've got a Q&A function. So if you want to type in your questions, and while you do that, I'm going to quickly go back to my slide, because I just want to tell you what we're doing on the NPDA with children and young people next. So as Emma said, her team is doing some clinic chats that are tackling issues around the national data opt-out, which is a worry to us and a lot of other services who are nervous about the impact and the burden of applying that. The NPDA reporting in the public domain, so that's potentially real-time feedback on care during the audit year. What do families, what do children and young people think about that? And then their experiences of the first year of care. We've been commissioned to do another PREM as part of the new contract. But we don't want to just rerun the same PREM. I think it's too soon. Teams haven't had enough time to implement anything off of the back of the last one before we start running that again. So we thought we would add value by just looking specifically at the first year of care. You'll receive some more information about that soon. And further to the type 2 work, showing that children and young people wanted more youth-focused information about type 2 diabetes. We've commissioned some content linked to our priorities from DigiBeat. So far, DigiBeat has been type 1 only, so we're delighted to be able to contribute to that. And we've commissioned the Association of Young People's Health to do a big engagement project looking at the reasons behind unequal use of tech. I'm not going to say access to tech, but unequal use of tech amongst more deprived and ethnic minority groups, and barriers to achieving optimal diabetes control amongst those groups as well. So we've got a lot going on over the next couple of months. Yeah, I'm just seeing if there's any questions. I think, Emma, maybe you've been so comprehensive in your advice. We don't have anything so far. Is that right?
No problems. I mean, people can send in questions if they've got
hand up.
Oh, hand up.
Yeah, let's see if we can spotlight. I'm not sure. Normally we do a live event. Let's see. Okay. I'm getting an email saying the chat is switched off. I know that. The Q&A function should still work, and I think that might be an easy thing to manage. So if you just look at the top, there's 2 speech bubbles there that say Q&A.
Shall we allow mic for the person that's got their hand up?
Oh, here we go. Now I see the questions, right. So we've got one, Emma. The difficulty of talking to young people is they are often too polite, which drives them to tell you only the things that you would like to hear.
Yeah.
Do you have any suggestions around that?
Yeah, definitely. So we find that as well, even with our stuff too. I think that goes back to that power dynamic thing, is there someone else that you can work with, maybe within your trust, that they know that they're not in your clinical team directly. So if you've got play workers, hospital youth workers, maybe you've got local contacts that you can bring in, charities, or there's a way that maybe you could work with maybe some trainees or some students and kind of like borrow between different conditions, just to give them that sense of separation, because it's really hard. They owe a lot to you, and they know that they want to do their best for you as well. So sometimes it can be really hard. I think it's also about how we set it up. So if you've got any trigger materials that you can use, so printouts of like the emoji cards and the being me posters, if maybe there's a question of the month box and you can give them a card with the question on it and then tell them to post it in, so it's a little bit more anonymous, but it's not a full survey, then that could be something actually that could just help to get a few more ideas together.
Thank you. And then we've had another comment about potentially making spurious conclusions about care quality when there's different numbers of PREM responses being returned by each unit. Absolutely, it's a consideration. Obviously, the larger the sample, the more reliable, valid your results are going to be. We apply a fairly low threshold, actually. We produce PREM reports for services that have achieved 10 or more responses to each survey. And then we did run analyses on the first PREM. We were interested to see if a unit had a lot. We tried to correlate the percentage of patients returning a survey with adjusted HbA1c results. We thought, I wonder if teams who are more successful at persuading their children and young people to complete a survey are more successful at getting them to adhere to diabetes management advice. And we could not find a link. And we also did not find a link between, or we couldn't correlate numbers returned and overall PREM scores. So we did look at that. I would like to reassure you. Any more questions?
There's a question as well about Hospital Youth Workers Forum. So I'm just going to post the link. It's run by Nottingham Hospital Youth Service. So Donna is the lead and the chair. They've got a Twitter link. We're just about to get an NHS Futures platforms on the steering group as well. But if you want to email me, if you're looking to recruit a youth worker in Oxford, I think, then I can link you up to the Diabetes Youth Work Forum. It's just a subgroup of the health-based youth workers one. And I'm sure they can share how they've done it, how they've got their funding, what their JDs are, all that kind of stuff. So I've just popped that in the Q&A box as well.
Okay, well that brings us just past 2. So any more questions, please don't hesitate to drop us a line at npda@rcpch.ac.uk or contact Emma with the details that she's already shared. We'll send an email with the link to this webinar as soon as we've edited it and got it up online. So just thanks so much for your time, and we really look forward to seeing you in person in the future. I hope some of you are able to attend our conference that's going to take place in January. It will be hybrid for those of you who don't want to attend or can't attend an in-person event, but yeah, we really missed seeing you. It would be really nice to see your faces right now, rather than, well, it's very nice seeing your face, Emma, but yeah, we miss you. So yeah, hopefully you can come in January or attend in some capacity. But yeah, thanks for joining us today, and we hope that's been a useful session. Thank you.
Thanks, everyone.